All right. Hello, hello. How's everybody doing? Ooh, I have a zit. Mm. Okay, so tonight, what I want to talk to you about is gyne is Gynecological Cancer Awareness Month. All right. Now, and for those of you who don't know me, my name is Trinette Stanford, and I'm a nurse practitioner and diabetes health and education specialist. But I'm, like I said, I'm a family nurse practitioner, and for years I worked in family medicine. And one of the things that I did do was work in a health department that had a women's health clinic. So when I saw that this was a special day today, or a special month, I needed to come in and to share it with you because it is very important. Um, Years ago, when I was working in a primary care office, and I had a panel of patients that I saw that were assigned to me, and I became very close to my patients. I wanted them to like me, and I wanted them to trust me. So I had I had strong bonds with my patients. So one lady had come in, and she was older. She was in her 60s. Well, then it was older to me. Now I'm in my 60s, so it's like it's not that old now. But anyway, she was in her 60s, had multiple births, and was basically healthy. So she came in and told me that she had gone to the emergency room because she was having some abdominal pain, and she was having some stomach pain. It was really bad. And I said, well, what did they do? She said they gave me something for pain and sent me home and told me to follow up with my primary care, who's you. And I said, okay. So I started asking questions. Are you having any bleeding? How severe is the pain? Any change in your bowels and different things like that. So, and all of that was negative. So I sent her to have an ultrasound done. And because that was the quickest test that I could do that would show anything. And she did go have the ultrasound done, and it showed that she had ovarian cancer. So I referred her to a gynecologist, and he called me and told me he said that was a good find. He said, that was really good because she could have been in very bad shape if it had not been discovered when it was. So he was able to go ahead and do surgery, remove the cancer and everything. And she lived several years after that. But, and I'm saying all that to say that things can be going on in your reproductive system, in your uterus, in your ovaries, and you don't really know it. And especially as we get older. I had another patient one time who was in her 70s, and I asked her when was her last pap smear, and she said, it's been years. So I did a pap smear on her, and sure enough, when it came back, she had stage 5 cervical cancer. So sent her in order, and they did a hysterectomy in order to remove it. I'm saying that to say, if you do not get regular exams, things can be at a stage where it's really desperate. So that's why I always encourage you as women, you as patients, to make sure you get your exams. Make sure you go and advocate for yourself. I know the standard is now that if you've had a normal pap smear 2 to 3 years, then, and especially if you're older, you don't have to have another one for several years. But in my experience, the risk of cancer increases as we age. There's more of a risk of developing cancer when you get older. So I would say every other year, if you've had a normal pap smear, then yes, every other year should be sufficient in order to have a pap smear done. Now, there are some red flags that can present themselves. And one of them is bleeding, especially if you've gone through menopause. If you have stopped having cycles years ago and then all of a sudden you start bleeding again, that's a red flag. That means something is serious going on and you need to get seen about immediately. Another red flag is abdominal pain. If you're having pain in your stomach that is something completely new that you never had before, you need to go get it checked out. Don't let them blow you off and say, oh, it's nothing. No, you need to have an exam. And when you go in, they need to do a pelvic exam. That means that, yes, you got to get up in the stirrups in order for them to look at your cervix and to do what we call a bimanual exam, where they go in and they feel your abdomen at the same time that they have their hand inside of you. I know that's gross, but that's the way it is. In order to, because then that way, if there's any tumors or growths, anything in your pelvic area, they can detect it. All right. Another thing that is a red flag, that if there's changes in your bowels, that is something that's quite uncommon, or increased pain or pressure when you urinate. All of those can be signs that there's something going on down there that needs to be paid attention to. All right. So it's very important that you get the pap smear. That will determine if you have any cervical problems. Now, if you've had a hysterectomy, no, you don't need to have a, well, if you've had a hysterectomy because of fibroid tumors or abnormal bleeding or something like that, you really don't need to have a pap smear. Now, if you've had a hysterectomy because you had cervical cancer, then yes, you need to have um, a, it's not a pap smear because you don't have a cervix, but you do need your vaginal area looked at because you may be at risk of developing abnormal growths in your vagina. So that needs to be paid attention to. All right. The other thing is if your ovaries are still in place, if you still have your ovaries, that's another reason in order to have the ultrasound, because a lot of times they cannot detect or they may not see any abnormalities in the ovaries. But if you can have a vaginal ultrasound, and if you go to a gynecologist, a lot of them have ultrasound capabilities in their office. So to have a vaginal ultrasound, then that way they are able to look at your ovaries to make sure everything is okay. Now, those are some things that need to be looked at. And the last one that I want to talk about is a mammogram. We always need to have a mammogram at least once a year. Now, if you have a history of um, breast growths or things like that, yes, you need to have a mammogram. And sometimes they need to do an ultrasound too in order to differentiate the type of tissue that is there. And also, if you've had breast implants, or if you're younger, a lot of times women who are in their 30s, their breast tissue is not so much fat, it's more muscle. So an ultrasound, excuse me, is more sensitive in order to pick up on those changes. So it's important that you get those checked out. Also, like I said, have a mammogram at least once a year if you don't have any problems. That's just regular prevention. Now, of if there's a family history of breast cancer or any kind of female organ cancer, then you need to let your provider know that so you can be screened for those things. All right. Because I know that the incidence of breast cancer in younger women is increasing. I know a young lady now, well, she had a strong family history. Her mother, her sister, and I think an aunt or a grandmother died of breast cancer. So, and she developed breast cancer in her early 30s. So some of them have strong bloodlines. So you need to make sure that you get it checked out. All right. This is not a time to be shy. It's not a time to be what's the word I'm looking for? It's not a time to think, okay, I don't want to go through all of that. Yes, you need to go through all of that because your life can depend on it. I always say prevention is better than a cure. So it's much more easier to take care of things early than to wait until they have progressed so far until you have to have something drastic done. I have another story. When I was working for the health department down in Mobile, we had a women's health clinic, and this young lady came in, and she was in her 20s, and she told me, she said, I felt something um, abnormal on my breast. So I examined her and I asked her, and we questioned her and everything. So I did send her for an ultrasound to have it done. And then they did a biopsy. And sure enough, she had breast cancer at the age of 28. But the thing that is so important, she had been doing self breast exam every month, so she knew her body. And that's another tip I want to leave with you. When you examine your breasts on a monthly basis, you get to know your body and you get to know what's normal and what's abnormal. And so she knew that there was something wrong. And sure enough, I mean, when she went to have surgery, it was like the size of a pea. It was nothing really large. So she was able to get treatment and everything was fine. So it's important that you do those self exams and that you get to know your body. And a tip about an exam: if you are still having cycles, if you are still having regular monthly periods, then you need to wait until after your period to do your exam. Because if you do it before your exam, there can be some hormonal changes in your breast. All right. If you're not having a period, if you've gone through menopause or if you've had a hysterectomy, then just pick a day of the month that 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 day of the month, every month, you will check your breasts. So it will be on a consistent basis. And then for your mammogram, the easiest way to keep up with that, if you have it in your birth month, every year on your birthday, in the month of your birthday, that's when you go have your mammogram. So then you know that you are keeping up with it. All right. So that is what we want to discuss for Gynecological Cancer Awareness Month. And you can go to your primary care if you have a primary care who does vaginal exams, who do pap smears, who does all of that. That's all well and good. Or you can go to a gynecologist who is a who is a specialist in that area, and they will do that. All right. So that's what I have for you. And if you have any questions, do not hesitate to leave comments and to leave questions. Okay. So I want to thank you for your attention, and I will see you on the next recording. Bye.